Now, when you're doing that in terms of having students be together and connecting, you do have the possibility of there being some transmission of COVID. And you've had some universities that have become real hotspots. So what is the plan now that, students are coming back into these hybrid environments, some in person, some virtual? What happens if there's an issue? Is there a plan in place?
What I can say is basically from my vantage point as a member of the faculty at my own institution, which is that institution-wide, the mask requirements are in place, and faculty on the university side have been given general information about how to address any resistance to adherence to those mask requirements. My general sense of the students is that there's particularly in the medical sciences, which, many of these students are in a position as they transition into their clinical years where they're essentially functioning as an apprentice physician, are in clinical environments. We expect them to keep the safety of the patient as paramount, and they're similarly in those instances required to wear a mask and are given access to the same kind of protective equipment that we expect the faculty in those environments or the other clinicians in those environments to have access to. I know that at different phases in the pandemic, there were decisions made about protecting students from direct patient care with known COVID positive patients just because of the concerns about PPE. And briefly, in a lot of medical schools around the country, there was, rotations were suspended for a period of time in order to be able to do kind of a full safety assessment to do what was necessary to ensure we had physical spaces allocated safely for distance. We usually are working in very close quarters, in the hospitals and in the clinics. There's commonly a pretty crammed, shared space where the student doctors and the preceptors, as we call them, are all together, sitting shoulder to shoulder almost. And so we had to do a lot of reimagining of how we were going to use clinic rooms, how we would involve them in some of the virtual care we're now doing. And I think there's been a lot of challenges in all of that. But I can speak, at least at my institution, my sense is that there is a clear understanding of the importance of following the masking and social distancing guidelines that are in place. There's a lot of signage posted. There's conference rooms that have been repurposed into places where people can safely take breaks and eat lunch and, be distanced from one another. And we're really thinking about how the students can continue to learn so that they can stay on track in their trajectory to, transition into residency programs and the like, but do it in a safe way.